legislation.
And now I'd like to switch it over to Natalie, who's going to give us a case study number 2 of what's going on in Memphis and Delta.
Yeah, I'm going to do the Delta region kind of, but Tennessee for the most part, because that's where I'm located now, and I moved from a red state to a red state, and so I was like, hey. But I would hope, though, that with what I'm going to tell you, I want to give you some historical and cultural context, especially to Tennessee and Memphis's location on the Mississippi River, and what kind of history comes with that, and then how it disproportionately affects women of color. And then the Delta region as a whole can see these kinds of effects as well. And I'm going to point out some activists and some people that are working within this, though, so maybe this will be a lighter note. But I'm going to say some things that aren't light, too. So in 2005, there were 13 abortion providers in Tennessee, which is an almost 20% decrease from 5 years before. And as the years go on, the abortion clinics and providers continue to decrease within the entire region of the Delta. So 94% of Tennessee counties have no abortion provider. And if you think about the geographic landscape of Tennessee, and then you think about where the urban centers are located, you're leaving 75% of that state without access to care. And so there's a large disparity in Tennessee and a large inability to be able to access reproductive health care. And so access to comprehensive education comes mostly from the women's centers that are located in places like Knoxville, Nashville, and Memphis, and Planned Parenthood. But one thing you need to understand about Planned Parenthood is that in the South, it comes with a lot of stigma. And so when you associate yourself with things like Planned Parenthood, or when you go to seek those services, you're running into a social problem. And so there will be things that you encounter when you do these things that will be different in a red state, as you probably already know, but it's very important to understand. And so just here's a little piece of legislation from Tennessee. Tennessee State Representative Stacey Campfield has proposed legislation that would require a death certificate for each induced termination of pregnancy which occurs in this state be filed with the Office of Vital Records within 10 days after the procedure. And so that's interesting. What I can conclude from this is that this probably would also give some consistency to when and what is a life. So based on factors that are already consistently used in red states. So that's interesting for something you keep in mind. Like Tennessee is different from Oklahoma. There are more well, when I say clinics, one thing you need to understand is I'm talking mostly about private physicians who perform abortion, and then services that are provided in addition to abortion. And so I'm not talking about an abortion clinic. I'm talking about a place you can go to receive an abortion, but there are other things being offered there. And so that's one thing to keep in mind as I talk about this. But so that's just one thing I wanted to throw at you guys, and it's interesting. Tennessee also has a legacy of discrimination in their reproductive health legislation. So moving on from here, I'd now like to tell you a little bit about some interesting legislation and Tennessee's doubly interesting environmental link with reproduction, and that's what I was telling you earlier, the cultural context that surrounds this. So a fun fact to consider about Tennessee, and some of you may already know this, is that there's activism to be had here, obviously, but you've probably heard that the new health care bill has a clause in it that allows states to opt out of abortion coverage in the insurance provision. So it's, again, that separation of abortion from the medical. And so if you think about it, and this is how I think about it, there will probably be dozens, if not 50 state legislative battles over abortion coming up, right? Well, let me just tell you that Tennessee realizes this, and they're on their pony about it. They look to be the first to try and outlaw abortion. We like to be the first, and so even though the exchanges don't start until 2014, so keep that in mind. This is 4 years beforehand, but they're thinking on it because it's a wedge issue. So according to several news reports, including one from a reliable source, the Kingsport Times, Tennessee will opt out of using state tax money to pay for abortion services and state health care exchanges under legislation already passed on a voice vote by the House Commerce Committee last week. So Representative Hill of Tennessee has already formally declared that the state has to take action on it to opt themselves out of it, so Tennessee tax money isn't used for it. What did I just say? I said it 3 times and I never said abortion. It's something really important to realize that language plays a really big part. And this is a quote from Representative Hill. And so, interesting, right? Because he couldn't even say it in his quote. And so that's their stance on that. Kind of moving on here, the idea of language, what is and is not acceptable, is something I'd like to revisit later just for a second, because we've all kind of talked about it. We're kind of building an idea around it, and I want to engage you guys on that in a moment. But this is just a small taste of what activists in Tennessee face in their work around policy. And I heard someone mention earlier when we asked questions about, what do you guys think, what would and wouldn't be acceptable, someone mentioned something about how we should take into consideration the context that surrounds people's lives in the South when they go to get reproductive health. And that's actually something that you can do more research on, called everyday violence. And it's the idea that you're accepting your lot in life. And so by accepting that I don't get this care, I don't realize, and this is lack of activism, right, or lack of resources or knowledge base, I don't realize that this isn't what's supposed to be happening to me. So something to keep in mind as I talk about this really quickly. I'm going to try to really quickly. So let me see, where was I? So activists in Tennessee face a lot of work around policy. So shifting gears a little, it is important to understand how these attitudes and political choices that I just mentioned affect women in Tennessee disproportionately. Mainly because there's a legacy of racism and a lot of other things that happen in that Delta region. And when I say Delta, I mean the areas that surround the Mississippi River down into the Gulf. And so I'm speaking to Louisiana, and I'm speaking to Mississippi, and I'm speaking to parts of Kentucky and a little piece of Arkansas there. And I think I just forgot someone, but you can look at the map. Women of color within the reproductive rights and justice movement in Tennessee are exposing these types of policies, and they're speaking to the ideas of eugenics and population control that have permeated their communities institutionally and have for decades. So this is where I want to move into that positive shift of, I'm going to mention a few people who have talked about this, and then tell you what I can see happening in Memphis, Tennessee right now. So these women are fighting back, and Miriam Perez, who's here, and I think she did the blogging thing, which is fantastic, she actually highlights the struggles of women of color very well, and speaking on the environment. She shows how this movement, the environmental rights movement, how their actions place blame on women of color for things like challenges related to resource scarcity and family size. And this is something that's very pervasive in Tennessee. And there is an active movement happening around creating more opportunity for safe and easy access to contraceptives, abortion, and increased childbirth and parenting choice options. And that's really important to note, because there is also a stigma related to minorities in seeking abortion, and so parenting choice and then family planning in general, that's very important. It's very important to make sure education is there for those things as well. And so, these issues permeate Tennessee activism, as well as activism in many southern red states, speaking to the Delta again, where environmental issues related to unemployment, health disparities resulting from disproportionate toxic burdens, environmental racism, and poverty play important roles in understanding the holistic view of activism. So just keep that in mind. These fights or struggles are compounded by issues related to government representation and policy. So like welfare institute family caps. I mean, that's something that you have to keep in mind when you think about those things that surround the reproductive health struggle. This limits a woman's choice on her family size. Women in Tennessee are great examples of why reproductive justice is important. So representation is important, and partnerships to instigate change must be made at all levels of activism. And so the dialogue needs to represent the policy voice, the access voice, and the installation of trust. Trust is really important, because when you look at the legacy that surrounds some of these red states, you're looking at people that were abused by the biomedical system. And when you're dealing with that, you need to educate the people working in that system to be sensitive to these cultural needs and be competent in the way they present their care. So these are other issues that surround the abortion debate and access and activism that we need to be responsible for when we come from here to Tennessee and we're going to put in an abortion clinic and things are going to be fine, and we're ignoring the people protesting it, we're just going to offer it. You then have to realize that there's a level of trust you have to build in this kind of a community.